So thanks everyone for joining us today. My name is David Lamb. I'm director of the Institute for Social Research at the University of Michigan, and I'm very glad that you could all join us today for this very important presentation. For those of you who are unfamiliar with ISR, our faculty and staff conduct research on a wide range of socially relevant topics, including aging and health, teen drug use, economic behavior, wealth and inequality, race and racism, and politics, among many other topics. We also have state-of-the-art expertise in surveys and survey design, data archiving, and we offer training of the next generation of social scientists. We have over 300 faculty members with appointments all over the University of Michigan campus, a reflection of our true interdisciplinary work in ISR. In establishing this ISR Insight speaker series, our goal was to create a forum for disseminating research findings of our faculty at ISR for the public good. Today's talk, I'm very excited about, is about the impact of COVID-19 on the city of Detroit. The COVID-19 pandemic has laid bare and exacerbated inequities for communities of color, as we've all learned in recent weeks. Today's talk will illustrate some of these harsh realities in Detroit, one of the nation's hardest hit areas. In addition to our panelists, who I'll introduce in a moment, I'm joined today by Sherry Nataro. Sherry is ISR's Director of Diversity, Equity, and Inclusion. And before I introduce our speakers, I've asked Sherry if she would say a few words. Sherry?
Thanks, David, and thanks everyone for joining us today. We at the Institute for Social Research recognize the weariness, the anxiety, the anger, and the betrayal expressed by so many as our nation grapples with the continued examples of racial injustice. As David said, COVID-19 has laid bare so many of the inequities that exist in our society. And nowhere has that been hit harder than Detroit. We want to acknowledge the many forms of injustice that are playing out in social media right now and across the nation and internationally as well. We join the nation in mourning the recent deaths of George Floyd and so many others. At ISR, our efforts to conduct and promote social science research are founded on our desire to build an inclusive and equitable world. We do that both through our study of broad and diverse communities and by building a diverse, inclusive, and equitable organization. Our Insight Speaker Series is one way we hope to share some of the important work underway at ISR to advance social and racial justice. Please reach out to David or to me if you have any questions or would like to learn more about our efforts at ISR. Back to you, David.
Thank you very much, Sherry, for those important comments. As Sherry said, this ISR Insight Speaker Series is one way we hope to share some of the important work underway at ISR, which continues decades of research on social justice issues. And this represents one way to pass along and share the research we're doing related to social and racial justice. It's great to see so many of you here for this virtual event. We're going to try to hold these every 2 weeks or so and post information on our website and on social media. These are being recorded and will be available after the talk. I'm very happy to introduce our speakers today. Jeff Morenoff is Director of ISR's Population Studies Center and Professor of Sociology and Public Policy here at the University of Michigan. He's joined by Lydia Wileden, who's a PhD candidate in Sociology and Public Policy and a trainee in ISR's Population Studies Center. In their talk today, Jeff and Lydia will discuss efforts by the Detroit Metropolitan Area Community Study, DMACS, a panel study of more than 11,000 Detroiters to capture the real-time experiences of Detroiters and share insights from 2 survey waves on the dramatic financial precarity facing many Detroit households and the behavioral and economic changes residents are making to get by. I'll note that they've done a great job at DMACS of very rapidly getting into the field to add components to their study to look at the impact of COVID on the city of Detroit, a great example of rapid response of ISR survey research. I want to note that we will have question and answer at the end of the presentation. I invite you to send in questions. There's a Q&A feature on Zoom that you can find. You can use that to submit your questions, and we'll try to do our best to answer those questions after the presentation. So thank you very much for joining us today. Enjoy the presentation. I'm very much looking forward to it. I'll turn things over to Lydia.
Great. Thank you, David. And thanks to the whole ISR team for putting this together, and to those of you who are able to join us today and are taking an interest in our work. We're really glad for this timely opportunity to share this work with Detroit residents, with our fellow researchers, and with the broader public. We want to also acknowledge the full DMACS team beyond just Jeff and myself who make this work possible. That includes Detroit residents who have served as our field canvas team and who really serve an important role as stewards to the community and support our local outreach efforts. To say that these are difficult days in Detroit really fails to capture the weight of this moment. And in the face of the pandemic and the ongoing demonstrations against racial injustice and police brutality, we stand with the residents of Detroit, many of whom are confronting the double burden of grief brought on by this moment. That grief, let's not make any mistake, is disproportionately shouldered by residents of color. So throughout our presentation today, we aim to give voice to the thousands of residents who have graciously shared their perspectives with us to guide meaningful change in the city of Detroit. To give you a sense of what we hope to cover in the next 30 minutes, we're going to begin by sharing some more background information about DMACS and touch on some survey results from prior waves of our study, specifically focused on trust in police and racial justice that are of particular relevance in this moment, before turning to our COVID work, where we'll discuss how we pivoted the survey to respond to this particular moment, and then also digging into our results focused on the health impacts and the financial impacts of the crisis. Throughout, we're going to touch on the ways in which the pandemic has likely exacerbated and entrenched some of the racial and economic disparities within the city. And we're also going to make some comparisons to results from a national survey that coincided with the timing of our own study that we think helps contextualize what we're seeing in Detroit and how those results that we are finding might buck or be an extreme example of some national trends. So with that, I'm going to throw it over to Jeff to give a little bit more background on DMACS.
Thank you, Lydia, and thank you to everybody who's participating today. And I just wanted to share in acknowledging what Lydia and Sherry and David already said about the solemnity and the gravity of the current moment. We hope that this is also a time where this project it becomes particularly useful to the citizens of Detroit, the government leaders of Detroit, the business and nonprofit leaders of Detroit. We realize that there's a lot more change that has to happen, and we hope that we are making some small bit of difference in trying to provide the public with information that can help guide us through both the pandemic and the crisis related to racial justice and police brutality. I also wanted to note, because I'm not sure if David or anybody else mentioned this, that we will be taking questions, and there's a Q&A button, I believe, at the bottom of your screen that you can use to send your questions at any time, but we will probably address them at the end of the talk. So to begin with, I wanted to acknowledge and talk about a really pivotal and important study that was here at ISR for over 50 years that many of you who are on the call probably have deep knowledge of, the Detroit Area Study, which ran from 1951 to 2006. And what you see to the right of the screen here are some original notes from Ron Freeman about the purpose of the study. And when I became director of the Population Studies Center in 2012, Detroit was soon to be sliding into bankruptcy. And there was a lot of talk about the need for ongoing research in Detroit, and a lot of bemoaning of the fact that we no longer had a Detroit area study. So I started thinking about what a new Detroit area study might look like. I reached out to Liz Gerber, a colleague at the Ford School, who's a political scientist who does a lot of work in public engagement of different levels of government. And we started thinking about how we would construct a new Detroit area study. And there's a few ways, there's a lot of ways in which we're building on it. I mean, the DAS, first of all, I want to acknowledge that some of the current members of the ISR community were PIs of the DAS, including Ren Farley and Mike Traugott and Bob Marins and Michael Barr, the current dean of the Ford School. It rotated every year to a different PI, had a different topic every year, but the consistent part of it was that it was a representative probability sample of the city of Detroit and in some years the surrounding metro area. We wanted to maintain that. We did not want to go towards kind of a new-fashioned opt-in online study. We wanted to make sure that we were doing an old-fashioned probability sample that was really representative of all voices in Detroit. But two things that we wanted to change were, number one, to make it more truly longitudinal, in that in addition to having representative samples of the city year after year, we wanted to be able to follow people and have a panel study. And you'll see as I go along how we've achieved that. And then the second thing, which is highlighted on the screen, is that one of the original goals of the DAS, which I would say is probably one of the few things that it was not as successful in doing, was to engage with the broader public in Detroit about the findings of the study. And we wanted this to be a study that's not just used for research, but that has wider audiences and that can be used to help inform evidence-based decisions about investments and policies that shape Detroit. So with that, let's go to the next slide. So that brings us to our project, the DMACS, which stands for Detroit Metro Area Communities Study. And it's been ongoing since 2016, although the break in this timeline between the maize and the blue part signals like a change in our model. And it really began in earnest in 2018 with a grant from the Knight Foundation. Prior to that, we were getting our feet wet, and with the great help of the survey research operations team at ISR, trying out our content on citywide surveys and getting good results. And then we transitioned over to building our own survey field operations team and our own permanent staff, many of the names of which Lydia put up on the previous slide. And another big change that we made at that point was that we said that every survey going forward, we're going to have at least one community partner on, so that we can ensure that the data are being used to inform some kind of evidence-based decision making. We've been fortunate enough to have some very excellent partners, including the Detroit Health Department, the Michigan State Housing Development Authority, the United Way, the New Economy Initiative, which is a nonprofit group that looks at the idea of inclusive entrepreneurship, and Detroit Future City, among others. So we are continuing to do these surveys, but the big change, as Lydia is going to allude to, is that up until the COVID crisis, we had done 6 different waves of our survey, and we were on par to do about 2 to 3 of these a year. 3 would be a busy year. Now we're doing 1 a month, and we'll probably continue to do that in the near future for an uncertain amount of time. But it's a fast pace. It's been challenging, but it's also been very rewarding. Let's move on to the next slide. This is some more examples of engagement that we've been doing and the audiences that we're trying to address. And the point I want to make here is that although this is a research project, and you'll see on the left side of the screen, researchers are listed purposely as the last audience. There are a lot of other audiences that we're trying to reach, and up until this point in the history of the project, we're really actually prioritizing reaching those audiences over reaching the research community, although we want to do both. And we want to have excellent PhD students and other students like Lydia to come on and write those pieces that are getting published in academic journals, but we also want to be writing reports and doing various forms of outreach to make sure that our results get disseminated. Another message I want to leave you with here is that we built this to be a very open platform and a nimble platform that can respond to current events. So if any of you out there, whether you're researchers or whether you're not researchers and have some other role in the community, have ideas for what you'd like to see us be asking about, we are very open. We're always very open to hearing those. And we also try to make it very accessible to people who want to put questions on. These are just some, going back to that for 1 second, Lydia, these are just some examples of reports that we've written that are available on our website, and also media outreach that we've been doing recently. We had a couple stories get picked up by the AP and get distributed very widely during the COVID crisis. Next slide. I'm not going to spend too much time talking about sampling, although if you have questions, I'm happy to go into more detail on it. But it is a longitudinal probability sample, as I mentioned before. We do what we call multi-stage sampling, which means that we first select a representative sample of geographic areas, in this case block groups, and then within those block groups we select households, and within households we have one adult respondent. And we have also oversampled particular types of neighborhoods. We did an oversample of Latino neighborhoods at one wave because of the priorities of our partner, the Detroit Health Department. And then we also, more recently, have done an oversample of neighborhoods that are the focus of an ongoing initiative in the mayor's office that's called the Strategic Neighborhood Fund, that we are looking forward to evaluating as we go forward. The last point here is that we're also compensating our respondents. And during the COVID crisis, we've increased our incentive payments to respondents, both to reflect the ongoing need, but also to reflect the fact that we're asking people to respond in a rapid way, and that this is really infringing on their time. But we've had really great success in getting a lot of people to respond very quickly to our surveys, as Lydia will show you. Next slide. There's a lot here about that, but what we're doing is we're comparing the demographics of our most recent sample to American Community Survey data, and we're not perfect. I think we're probably a lot better than you would get with a so-called opt-in online survey where anybody can take it. We have a purposeful probability sample, but we do pretty well at representing the population, and then we weight our sample to make it much better. To start off with, the areas that we're a little bit short on, especially during the pandemic, which has exacerbated some of these problems, is a heavily female sample, a little bit underrepresented at younger age groups and lower levels of education, but really very close to the population in race, ethnicity, and especially income. We're almost spot on. Next slide. This is just some examples of the kinds of questions that we've asked in the 8 surveys that we've done so far. Right now we're focusing a lot on COVID, but just to give you an example, some examples of other things we've asked about, and we're putting more and more of this up on our website that you can look at in more detail. But racial justice and economic opportunity, health and healthcare, crime and policing, I'll have a little bit more to say about that in a second, blight and renewal, community attachment and residential mobility, transportation and mobility, utilities and other household expenses, water bills and water shutoffs are particularly relevant to a lot of Detroiters, and priorities for change, both from government and from a sense of business investments, like what kinds of changes do residents want to see happen in their neighborhoods? We ask a variety of different kinds of questions about that. Next slide. Okay, so I wanted to, before I hand it back over to Lydia to talk about the data we've been collecting during the pandemic, I wanted to take a moment to talk about some things that we've learned from prior surveys that are related to the current moment that we're at right now, involving issues of racial justice and criminal justice. And I can say with certainty that we're going to ask a lot more questions about this in upcoming surveys. But for now, what I'm going to show you are somewhat dated results that don't speak to today's current events, but are very relevant to the recent past. So next slide. We've asked on two different survey waves, both in 2016 in our first survey, and then in 2018 in our fourth one, for people's agreement with the statement that I trust the police in my neighborhood. And What we saw here was two things, I think, that are kind of striking. One of them is that there are racial disparities, racial differences, where not surprisingly, whites display more trust in the police, 50% to 36% in the first wave, 68% to 48% in the second wave. And if anything, those disparities have widened over time. On the other hand, the city did make some efforts to try to improve relations between police and the community, and that's reflected by some gains in the proportion of people who trusted the police across those two time periods. So we did these in 2-year increments. We're overdue for another round of these questions, and we will be asking them again in the coming weeks and months, and we will be able to monitor how this is changing. Next slide. We also have asked in the past about incidents like the George Floyd incident, which have been unfortunately far too common. And these are kind of paraphrasing the questions that we asked on our survey, but on the left, results from a question about whether respondents thought that local police would be more likely to use deadly force against African Americans. We gave them several options. Would they be more likely to use force against African Americans, more likely to be used force against whites, or equally likely against both groups? And 72% of Blacks said that police are more likely to use deadly force against other Blacks, and 48% of whites said that. Again, I mean, you could read these as a glass half full, glass half empty. There are kind of large numbers who realize that there are that structural racism exists, but this awareness and perception is particularly strong among Blacks, and whites are further behind. On the right, we see results of another question which asks about killings of Black men at the hands of the police. And this was asked in 2017, both of these were, and we asked, are these isolated incidents or part of a broader pattern of racial bias? So to kind of look at the hypothesis that there are just a few bad apples in police departments versus this is part of a systemic pattern. And the vast majority of Detroiters, but especially of African Americans, think that this is part of a broader pattern of racial bias. And again, we want to revisit these questions and the current climate and continue to track these numbers over time. There's a lot more I could say about that, but time is short. So I'm going to pass it over to Lydia to talk about the data we've been collecting during the pandemic.
Thanks, Jeff. And again, if folks have questions or would like us to speak more to some of those results, please do use the Q&A function, and we'll get to some of those questions at the end. So pivoting back to talking about the COVID-19 pandemic, Jeff made reference to a survey with the United Way that we were originally planning to launch in the spring of 2020, specifically focused on financial well-being. And as the crisis really presented itself, our team observed that maybe now was not the right time to be asking the same questions that we had planned about financial well-being. And so we pivoted and made use of our existing survey infrastructure and the relationship that we've cultivated with our panelists to really seize the moment and try to deploy our survey quickly in a way that could provide real-time information on the growing pandemic and its impact on Detroit. And as Jeff mentioned about the statistical rigor of our sample, I think one thing to also call attention to is that there are very few surveys about the pandemic that are focused geographically in the way that DMAX is. So though survey data on the pandemic has really proliferated in the last few weeks, DMAX offers an opportunity to look specifically at how the pandemic is affecting really a single community or a single city. And I think that offers some really unique insights into the uneven geographic impact of this crisis that is being masked by national and even by state data. This slide offers a graph of the timing of our survey waves in relation to the rising number of COVID cases and COVID deaths in the city of Detroit over the past 3 months. And what you can see from it is that timing of our surveys has really enabled us to capture 3 fairly distinct moments in this pandemic. So the first is the really rapid rise in cases, the exponential increase in cases in late March and early April. Our Wave 8 survey captured more of a leveling off period in terms of new cases and sort of a new normal of stay-at-home orders, but also a high increase in job loss. And we are in the field right now with Wave 9. We entered the field on May 28th and are excited to see how that survey captures changes in employment as well as people's behaviors as the state enters an opening up period and as the economy maybe starts to turn. Looking at these rapid response survey waves, this slide just summarizes some of the timing and the size of our survey samples for each wave. To draw our sample for these rapid response waves, we used our overall DMAX panel or pool of potential respondents, which is roughly 2,500 Detroit residents, and took from that a subsample of respondents whose email addresses or phone numbers or both we had access to. Along with the rest of the university, we have restrictions on face-to-face human subjects research, so our Canvas team that we had employed in previous waves obviously is not able to go out into the field and do that work. So we take a subsample of our population for whom we have these alternative modes of contact, and that creates the baseline population that we invited to participate in each survey wave. For example, in Wave 7, we invited 1,880 respondents to participate and got a response from 1,040 respondents, which is a response rate of about 55%, or exactly 55.3%. And I do want to acknowledge and celebrate our team in terms of just how high these response rates are compared to other surveys that we've seen, and also in comparison to some of our previous waves. We're really excited about the response and about the willingness of Detroiters to participate in these surveys, share this information, and especially do so in such a rapid and timely manner. And as I said before, we are in the field right now with Wave 9. We already have almost 1,000 responses, actually possibly more than 1,000. This is a number from last night. And that reflects already a 53% response rate. So very exciting for we survey researchers. I'm going to turn now to talk a little bit about what we've found. And before I dig into our results, I want to give a little bit of context, as I imagine not everyone on the call is necessarily familiar with Detroit and also familiar with the COVID-19 pandemic's effect on the state of Michigan. So Detroit is a majority African-American city. 80% of its residents are Black, whereas 15% are white and about 8% are Latino. And we also know that within the state of Michigan, that the COVID-19 pandemic has disproportionately affected communities of color. Within the state itself, about a third of COVID cases and 40% of deaths are for Black Michiganders, while only 14% of the state's population is Black. So I just wanted to offer that as context. And then also to note that as we dig into results, the data that we're going to share has been weighted to reflect the population of the city. Okay, so this is the same graph I shared before that shows the rising number of COVID cases. There are slightly more than 11,000 cases in the city of Detroit, and 1,300 residents have died from COVID. And while these are staggering numbers, they actually reflect a small proportion of the city's population. So our survey tries to pick up on the rate of infection in the city, and what we found at Wave 7 is that slightly less than 1% of residents had received a diagnosis either from a doctor as a result of a test or as a result of sharing their symptoms as being COVID-19 positive or coronavirus positive. And by wave 8, that had risen to just around 2% of the population. We also hear a lot about the lack of availability of testing in Detroit and across the nation. And based on our data, we find that about 3% of the population had been tested for COVID-19 at the time of our first rapid response wave, and that's risen to about 7%, or slightly more than 7% at the timing of our second wave. I do want to note that as of May 20th, all Detroit residents are now eligible for free drive-up diagnostic testing, regardless of symptoms and without a doctor's note. So ideally, in the next wave, we'll pick up on a much higher proportion of people who have been tested. Of course, testing and diagnoses only really capture one aspect of the health impacts of COVID. So we're going to look a little bit more in this next section about evidence of the further reach of the virus. So examining who has been exposed to COVID, respondents to our Wave 8 survey say that about 8% know that they've been exposed to someone who had COVID, while about a third say that they're unsure if they've been exposed. And this is maybe not surprising. I know I wouldn't be able to say for sure if I had been exposed or not, but I think it's worth reflecting on, especially in contrast to some of our earlier numbers, because it suggests a potential degree of asymptomatic infection in the city, as well as raises some suggestion of a potential rise in cases as we start to reduce our social distancing and interact more with others outside of our home. Beyond possible exposure, the impact of COVID infections has really been felt widely in Detroit. More than half of residents say they know a friend or family member who's become ill with COVID-19. But we see a stark racial disparity in this. More than half of Black Detroiters say that they have a friend or family member who's become ill with the virus, compared to only a third of white residents. And we sadly see a very similar pattern play out when we think about who knows someone who has died from the virus. Over a third of Detroit residents know a family or friend who has died from COVID-19. But Black Detroiters are 4 times more likely to know someone who has died from the virus. And I just want us to sit with that fact for a moment and consider the unequal pervasiveness of grief across Detroit, and what that really implies as we look toward the future. Given the current climate, the protests and demonstrations, I think that this is a helpful piece of context in understanding, again, that double burden of grief that communities of color are grappling with, and that we all need to rise to meet and help address. So early on in the crisis, it was suggested that Detroiters were not taking adequate measures to keep themselves safe, and that maybe that was a cause behind the high rates of infection that we were observing in Detroit. So this slide actually offers a comparison with some national data collected as part of the Understanding America study, which is hosted by the University of Southern California. And it shows some significant differences between the measures that Detroit residents are taking compared to the average American. And what we find is that Detroit residents are actually more likely to be engaging in social isolation, wearing face masks, than the average American. They're also more likely to be stockpiling food. And so there is a sense of need to protect oneself, but there's also maybe some behaviors that are not as beneficial in terms of just making sure that everyone has as much capacity as possible to get the resources that they need. I will note that we did a similar comparison in March with USC data, and that showed that though 30%, or about a third of Americans, had reported making no behavior changes in March in response to the pandemic. Only a third of Detroiters similarly were not making changes. So I think we can pretty fairly dismiss this idea that Detroit residents were not taking efforts to protect themselves and others. Of course, the pandemic has far reaches beyond the health of Detroiters, and there have been particularly severe financial impacts for the city and its residents. So I'm going to turn now to talking more about those impacts. Based on our data, we estimate that the unemployment rate in Detroit grew from 11% prior to the pandemic to 48% at the time of our Wave 8 survey. And for context, that's about twice the statewide unemployment rate and more than 3 times the US unemployment rate. And again, this is a moment where DMAX is really able to reveal disparities, geographic disparities that a lot of other available data glosses over or masks. It's relatively rare to be able to calculate an unemployment rate for a single city as opposed to a metropolitan area or a county. And it's exciting that DMAX enables us to make this type of calculation by looking at the number of people who tell us that they're in the labor force compared to those who are currently employed. Detroiters also suffered a very high rate of job loss. So this is looking at the proportion of people who said that they were employed prior to the pandemic and are no longer employed or have lost their job since March 1st. I will say that this proportion, the 43% who say that they've lost their job, roughly 2/3 of those say that they have been permanently laid off, or I'm sorry, 2/3 of those say that they've been temporarily laid off, whereas 1/3 say they've been permanently laid off. So it actually remains to be seen really how severe this financial crisis is going to be, because at this moment, there's a large proportion of people who have the assumption that they'll be able to go back to work as soon as some of the distancing measures expire and businesses reopen. But we honestly don't know yet how realistic that is and how many businesses are going to have been permanently closed, and thus these unemployed will remain unemployed. Job loss is disproportionately hitting people who are more vulnerable or more weakly attached to the labor force. About half of working Detroiters who earn under $30,000, which is the median income for Detroit, report having lost their job, compared to just 1/3 of working Detroiters who make $60,000 or more. And again, we observe a really stark racial disparity in terms of working Detroiters who lost their job in response to the pandemic. Nearly half of working Black Detroiters report having lost their job, compared to 15% of white Detroiters. And for context, we also find that 41% of Latinos say that they have lost their job. Among those who have kept their job, we also observe some uneven risks in terms of exposure and ability to work from home and stay safe. So working Detroiters, people who continue to be employed during the pandemic, about an equal proportion say that they're working inside compared to outside their homes, but 3/4 of those who earn less than $30,000 say that they're working primarily outside of their homes. So again, having to put themselves at greater risk to maintain their livelihoods. In terms of how Detroit residents are responding to the financial pandemic or financial crisis caused by the pandemic, we see that a lot of respondents are adjusting their financial behaviors, including their saving behaviors and their spending behaviors. This graph captures spending behaviors and changes in spending behaviors as a result of the pandemic. And we find that about 85% of Detroiters say that they've adjusted how they're spending their money in response to the crisis. And that's split fairly evenly between those who are spending more and spending less. But if we look at residents by their income level, what we're finding is that low-income residents say that they're having to spend more money during the pandemic. And anecdotal evidence from our respondents suggests that this might be due to some price gouging within stores in Detroit, the need to buy more cleaning and sanitary supplies, the need to feed more people or to cover meals that were previously covered, like school lunches. And so we see that residents who make $30,000 or less, nearly half of them say that they're spending more money, which suggests that families already in financially fragile situations might be having to stretch their budgets even further due to the pandemic. Speaking of the high cost of food or need for food, what we find is also that about a quarter of Detroiters report that they're experiencing some amount of food insecurity right now in response to, or during the pandemic, and that is significantly higher than the food insecurity reported by American households. And when we look only at those households that have kids, only Detroit households that have kids, we actually find that about a third report that they're feeling food insecure, either worried about running out of food or eating less due to lack of resources. In addition to changes in spending, we're also seeing that there are some concerning changes in borrowing, which might have longer term impacts. So though the majority of Detroiters, I think about 75%, haven't changed their borrowing, we see that vulnerable populations are more likely to be increasing their borrowing. So those who have lost their jobs and those who already had unmanageable debt loads, so they've been borrowing more during the pandemic. And this might suggest that there are some growing debts that maybe don't have an immediate impact, but certainly might have an impact down the road. Adding to that, we find that about 37% of Detroiters used the opportunity from landlords or creditors to delay or skip paying a bill, while nearly a quarter just skipped paying a bill, be that rent, utilities, cable, a credit card bill, without permission last month. So this again suggests that there is a population of Detroiters who might have a growing ledger of debts that could lead to greater costs and greater financial precarity down the road, which is especially concerning because moratoria on utility shutoffs, evictions, and foreclosures that were put in place during the pandemic are now starting to expire or be rescinded, and will continue. I think that the moratoria on evictions was extended, but will be set to expire on June 12th. So, we could see a large watershed of evictions coming soon. So while this paints a picture of the severity of the pandemic in Detroit and some really important implications for how the city moves forward, we are thinking in our Wave 9 about how we can use data in the months ahead to ensure a safe and equitable reopening. So to that extent, we have included certain questions on our wave that's currently in the field in response to policy suggestions and also to some of our respondents' responses that suggest that we need more information about policy issues that they're facing. For example, a lot of our respondents have told us that they applied for unemployment insurance and have not received it yet. So trying to understand what is happening there and for which populations. We also are trying to pick up on the level of deferred medical care that exists because of the COVID crisis and if and how people are using telemedicine. And then another issue that has risen in interest for both governments and public health officials is residents' willingness to participate in contact tracing to understand and monitor the potential spread. So with that, I'm going to return to Jeff and see if he has any sort of closing thoughts before we turn to Q&A. And again, if you have questions, please share them in the Q&A section.
Thank you, Lydia. I'll be really brief because I do want to save more time for questions. I also wanted to let Lydia know that I took advantage of this Q&A format that we have to answer a lot of questions as Lydia was talking. We can also come back to some of those questions that I answered in writing and answer them out loud. I just want to close by saying that, you know, what we're trying to do now going forward is continue the kind of rapid response work that we've started during the pandemic, hopefully do more frequent surveys than we did in the past, continue to make, I don't know how long we can sustain the pace of monthly surveys, but we're going to try. And to also kind of stay aware of like what issues may be coming down the pike that we need to be asking about that we're not worrying about right now. For example, when we've asked people about challenges they've experienced during the pandemic, low on their list has been problems with transportation, because not a lot of people have had to leave the house. But as the economy starts to reopen again, there's this big question about how people are going to use public transit and other forms of transportation. Another example might be like residential mobility. How do these two crises that we're experiencing right now affect people's desire to stay in Detroit or to move to Detroit? So we're going to ask more questions about people's thoughts about how long they're going to be living in Detroit and willingness to consider moving. But there's plenty of others, and we also just want to get feedback from all of you to the extent that you're willing to give it to us about things that we should be asking. I'm going to close it there and turn it back to Lydia to help guide us through the Q&A.
Sure, great. So a couple of questions that we have received. Rob Marins asks if we have any plan to expand DMAX beyond the city of Detroit. Jeff, do you want to
Sure.
speak to that?
Let me first of all acknowledge how helpful and pivotal Bob's consulting and help has been in getting this project off the ground. And as Bob knows, we talked from the very beginning about trying to expand this beyond the city of Detroit. And we still have that aspiration in the name of our project. It's the Detroit Metro Area Community Study. That said, we haven't done it yet, in part because of funding limitations, and in part because we were trying to learn how to build our own research operations in a robust way. I think we're at a point now where we demonstrated the utility of the study, we go to funders and try to expand. We still have a relatively small research team, and we may need to expand it in order to support a wider geographic area, but that's a challenge that we are interested in taking on. So the answer is tentatively yes. I should also say we're interested in partnering with this is related to another question that Mike Traugott asked about how our results compare to other cities. We're looking around to see if there are other studies in other cities, such as New York, for example, which has a study that's funded by the Robin Hood Foundation, that we could partner with to do some more integration going forward.
Another question that we've received has to do with our ability to follow respondents over time, both in terms of their mobility as they maybe move around in response to the pandemic, and then I guess with previous waves as they've moved into and out of the city, and then also our ability to follow respondents and think about people within a wave and the timing of their responses within a wave.
Oh, okay. So let me try to tackle the first one. I can definitely answer. We are continuing to follow people as they leave the city. When we're when we're doing surveys that are particularly focused on things that are Detroit specific, like attachment to neighborhoods in Detroit, we don't ask a lot of those questions to the people who've left the city. We give them instead what we call like an exit survey, which is like questions about why they've left. But we continue to contact them and try to get responses to future surveys. During the COVID pandemic, and Lydia, you can correct me if I'm wrong, I believe that we've been asking everybody, regardless of whether they're in or out of the city, all the questions. I haven't checked recently to see how many people are currently in our panel that are outside of the city, but as time goes on and that number grows larger, we can do some more interesting comparisons of people who have left versus people who have remained. I don't think it's that large yet.
Yeah, I will add to that by saying that in our wave 7 and wave 8, we had a suspicion that the pandemic might lead to the doubling up of families. And so we asked about the changes in household composition, and about 10%, I can't remember if it's 10 or 15% of our households said that they experienced some type of change, either people moving in, people moving out, or the respondent themselves moving to a different location. But the majority of those actually turned out to be a lot of college kids returning home to live with their families. So we haven't really been able to pick up on very interesting differences within that relatively small population that say that they have had a change in their household. And then in terms of answering the question about being able to respond or to examine responses within a single wave and how they might be reacting to changes that happened during that wave period. For example, testing levels maybe before and after this May 20th date when testing became available to all residents. We have looked some at sort of day-by-day rates of responses, but because we have so many respondents who are very actively responding quickly at the beginning of, as soon as we announce a new survey, and then sort of a slower tail in terms of responses over time, it actually makes it somewhat difficult to really understand those distinctions, because we get really large errors for later responses where there are many fewer responses. But it is something that we've looked at. We just haven't felt super confident in reporting those and being able to kind of control for outliers. Right.
I see another question that I just wanted to read aloud and also get your reaction to, Lydia. It's about whether we're aware of any surveys that have investigated perceptions of Detroiters about the potential risks and benefits to getting tested, particularly for vulnerable people who can lose their jobs, housing, et cetera, as a consequence. Lydia, you're more on top of what other surveys are doing to the moment than I am. This is not something that we have asked about yet, and it is something that we should. The closest that we've come is on our current survey, where we started to get into the issue of people's concerns about privacy around things like contact tracing, and about their comfort doing like telemedicine, telehealth kinds of ways of getting their health care. But we haven't asked about the sensitivity around what it means to get, what the consequences are for getting tested. Lydia, are you aware of anything else on this?
No, I'm not. I don't know off the top of my head of surveys that have asked about sort of stigmas around testing. I will say that the USC survey, the Understanding America survey that I referenced, does ask explicitly about stigma. I think trying to capture ideas that the coronavirus is an Asian virus, or that communities of color might be more dangerous because of the higher rates of infection. And so I would maybe look there and see if they have anything specifically about the stigma of being tested. I will also say that on our 9th wave, the wave that's currently in the field right now, not only do we ask about this contact tracing, as Jeff mentioned, but we also ask about, for people who say that they have not been tested, we ask, why have you not been tested? And give them an opportunity to say, I don't think I need to be, or I think I need a note from a doctor, or I couldn't afford to pay for it. And part of our goal with DMAC, something that we've added to the ends of our surveys, is trying to communicate out some information about the pandemic. So in wave 8, I believe we included information about how respondents can look to see if they are eligible for a stimulus check. That was a function created through Poverty Solutions. And we also are very interested in sharing the information that now in Detroit, testing is free and available to anyone with an ID that says that they are a Detroit resident. So hopefully that will help work towards the destigmatization.
Yeah, thanks for reminding me about that open-ended question. Oftentimes on our surveys, when we're unsure exactly how to ask about something, we'll start with an open-ended question, and then on the next wave, the responses we got to the previous waves of open-ended questions will inform the way we ask it going forward. So this could be a place where we find people expressing their concerns about vulnerabilities to getting tested. We'll see.
We have a question about the policies about the moratoria on evictions and abilities to advocate for extending those moratoria. I will say that on our upcoming wave, we do ask about people's level of concern. So on wave 8, we asked if people had not paid their rent or mortgage to try to understand what the likelihood of risk is. And we find that about 65% of the population say that they've paid on time, and there's no difference between renters and owners. And then some received permission to not pay, and some had just skipped paying without permission. But on our 9th wave, we ask specifically about how concerned people are about the ends of these moratoria, and how likely respondents feel that they're going to be impacted by the end of it. So hopefully we'll be able to speak to that further. I would direct you to some of the work that Poverty Solutions has done around the moratoria and around evictions and foreclosures, because they are they have their finger really on the pulse of this and are tracking and advocating very actively.
And thank you for mentioning Poverty Solutions. I meant to give a big shout out to Poverty Solutions, because we really are, this project is really partnering very closely with Poverty Solutions. They've supported us both financially and academically, intellectually throughout this whole process. Yeah, big thanks to our friends at Poverty Solutions for supporting our work.
I see some people raising their hands. If you could submit the questions through the Q&A, just because I don't know that we have the ability to unmute anyone. We're also just about out of time. Someone asked if we have comparisons for the number of people who have worked outside the home in Detroit as opposed to state and national numbers. Oh, the person who raised their hand accidentally raised their hand. I know that the USC data does have information on who has worked outside of the home. They switched recently to a panel model where they assign each respondent a day of the week to respond, and then they autofill their previous employment or previous, any sort of previous responses, and continually ask them, has your condition changed? And so it makes it a little bit difficult for us to compare apples to apples working from outside the home in Detroit, the way that we're asking, to these national numbers. But that data is publicly available. You have to submit a form to be able to access it. But I definitely urge you to look into that data and try to see what those differences are. That's something that we're actively working on. But as Jeff said, we've done 3 surveys in 3 months, or maybe even less than that. And it's a little bit drinking from the fire hose. So there's a lot that we'd like to do, but just haven't gotten to yet.
Yeah, that finding though it really blew me away and a lot of us away. First of all, how many people are not able to work from home, and how starkly that is patterned by income and socioeconomic status. And Lydia referred to this, but just to reiterate, I think the numbers were like of people making $60,000 and more household income. About 2/3 of those people were working primarily from home, and I think only 4% of people making under 35,000. Lydia, correct me if I'm wrong. I might be a little bit off, but like in the single to low double digits of people at the bottom end of the income distribution are able to work from home.
Yeah, I think it was that 75% of people still employed during the pandemic report that they are having to work outside the home. And that has implications both for those risks of infection, and then also those families are somewhat more likely to have children. And so what that means in terms of childcare, and then just the broader possible spread of the virus. It's noon, so I think that we have elapsed our time. If anyone has additional questions, please feel free to reach out to Jeff and myself. I also want to point everyone to both DMACC's website and ISR's website so that we can, you can continue to stay attuned to the work that we're doing. And thank you all so much, especially during these days for taking the time and joining us.
Thanks, Jeff and Lydia. Fantastic job. And we had up to 130 people or more during it, and it was a great presentation. Thanks a lot. Thanks, everybody, for coming.
Thank you, everybody.
Thank you.
Stay safe.